Hi everyone, my name is Julianna, and today Daniela and I will be speaking about postpartum depression, or PPD. Before we begin, we would just like to do a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as X-University. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is postpartum depression, statistics, risk factors, and what are the warning signs. Then I'll pass it over to Daniela, who will go over treatment, misconceptions about PPD, coping with PPD, supporting someone living with PPD, supporting a client, resources, and important points to remember. Pregnancy and the arrival of a new baby can trigger many different kinds of emotions. In most cases, these emotions are excitement and joy, but it is not uncommon to experience fear and anxiety. However, depression can be a warning sign for a much more serious problem. Most new moms experience what is called the postpartum baby blues, which includes mood swings, crying spells, anxiety, and difficulty sleeping. These symptoms usually begin within the first 2 to 3 days after birth and may last for up to 2 weeks. However, some women may experience a more severe and long-lasting form of depression known as postpartum depression. It is important to note that experiencing postpartum depression is not a flaw or weakness, or even that something is wrong with you. It is simply a complication that can occur after giving birth. If you experience symptoms of postpartum depression, prompt treatment can help you manage your symptoms and help you begin to bond with your new baby. Postpartum depression is also referred to peripartum depression, as this term acknowledges that the depression associated with having a baby often begins during pregnancy and not always after birth. For many women with baby blues, they may experience symptoms for only 3 to 5 days, while others for up to 2 weeks. If symptoms are not alleviated after 2 weeks, you may have postpartum depression. Feelings of emptiness or hopelessness after childbirth are not an expected part of becoming a mother, and you should reach out for help if you are experiencing these feelings. While postpartum depression can be difficult, it is a treatable disorder. However, it is a very serious mental health disorder that affects your behavioral and physical health. Postpartum depression can interfere greatly with your everyday life and may make you feel unconnected to your baby, as if you are not the baby's mother and you may not love or care for the baby. These symptoms can range from mild to severe. Many women who experience postpartum depression also experience symptoms of an anxiety disorder along with postpartum depression. Depression is common after pregnancy, and it is estimated that 1 in 9 new mothers will experience postpartum depression. In Canada, 23% of new mothers reported feelings consistent with either postpartum depression or an anxiety disorder after giving birth. Mothers under the age of 25 reported feelings consistent with either postpartum depression or an anxiety disorder was higher at 30%, as opposed to 23% in new mothers aged 25 or older. It is thought that having previous experiences of a mood disorder such as depression can increase the risk of experiencing postpartum depression. Mothers who reported feelings consistent with either postpartum depression or an anxiety disorder, 31% had previously been told by a health professional that they had depression or a mood disorder prior to being pregnant. By contrast, among mothers who did not report these feelings, only 11% had previously been told by a health professional that they had depression or a mood disorder prior to being pregnant. Only 1/3 of mothers who report feelings of postpartum depression seek treatment. Of those who receive treatment, 39% receive counseling therapy, 38% received treatment in the form of medication such as antidepressants, and 23% received treatment that included both medication and counseling. Many studies have been done to connect the factors of one's life that may contribute to postpartum depression. These factors include psychological factors, and as previously mentioned, a previous history of depression and anxiety is among the factors that are associated with a higher risk of postpartum depression. There is also evidence to suggest that women with a positive history of depression are more susceptible to hormonal changes and can induct postpartum depression symptoms. Next is obstetric risk factors. Some studies have suggested that having 2 or more children due to higher psychological burden is more likely to be associated with the occurrence of depression. In addition, risky pregnancy is also associated with an increased risk of postpartum depression. These risks include conditions that lead to performing emergency cesarean section or hospitalization during pregnancy, as well as postpartum complications such as hemorrhaging. Next are biological and hormonal factors. Young age during pregnancy increases the risk of PPD. The highest levels of depression have been reported in mothers aged 13 to 19 years old, while the lowest rate has been seen in women in the age range of 31 to 35-year-olds. Along with this, increasing maternal age and maternal self-efficacy are associated with a reduced risk of postpartum depression. Next is social factors. The role of having social support in reducing postpartum depression has been shown in numerous studies. Reducing social support is the most important environmental factor in the onset of depression and anxiety disorders in pregnant women. Social support refers to emotional, financial, and intelligence support, as well as empathy relations. Spousal support during pregnancy has been considered the most important solution to promote women's reproductive health during their pregnancy. A past history of spousal sexual violence and other forms of domestic violence during pregnancy are seen as factors contributing to postpartum depression symptoms. Lastly are lifestyle factors. Factors of food intake patterns, sleep status, exercise, and physical activities may affect postpartum depression. Sufficient consumption of vegetables, fruits, beans, seafood, milk and dairy products, olive oil, and a variety of nutritious foods may reduce postpartum depression as much as 50%. There's a significant relationship between less sleep, fatigue, and postpartum depression symptoms. Chronic sleep deprivation affects glucose metabolism, inflammatory processes, social communications, mental health, and overall the quality of life. Signs and symptoms of depression after childbirth can vary and can range from mild to severe. Baby blues symptoms can last from a few days to a couple weeks after birth and can include mood swings, anxiety, sadness, irritability, feeling overwhelmed, crying, reduced concentration, appetite problems, and trouble sleeping. Postpartum depression symptoms, on the other hand, can be mistaken for baby blues at first, but these symptoms are much more intense and last much longer than a couple weeks, and these symptoms include depressed mood or severe mood swings, excessive crying, difficulty bonding with your baby, withdrawing from family and friends, loss of appetite or eating too much or too little, overwhelming fatigue or loss of energy, reduced interest and pleasure in activities you used to enjoy, irritability and quick to anger, fear of not being a good mother, feelings of worthlessness, shame, guilt, or inadequacy, restlessness, severe anxiety and panic attacks, thoughts of harming yourself or your baby, and recurrent thoughts of death or suicide. When to see a doctor. You may be reluctant or embarrassed to admit that you may have PPD. However, if you are experiencing symptoms, it is important to get help right away, so be sure to call your doctor and schedule an appointment or reach out to any online services that may be able to assist you during this difficult time. It is important to call your doctor as soon as possible if the signs and symptoms of depression have any of these features. They don't fade after 2 weeks, are getting worse, make it hard for you to care for your baby, make it hard to complete everyday tasks, and include thoughts of harming yourself or your baby. Next, Daniela will go over treatment if you are experiencing postpartum depression.
Now we'll discuss some treatment options. There are a couple treatment options available for postpartum depression, including psychotherapy, medication, or a combination of the two. Psychotherapy is where you'll talk to a professional, and this can be beneficial to individuals living with PPD. It will provide the opportunity to learn tools to cope with the mental illness, problem solve, set goals, and reframe negative thinking patterns. Sometimes some individuals will also go into relationship or family therapy. There's also medication. Sometimes antidepressants may be prescribed. Most antidepressants can be taken during breastfeeding with minimal risks of side effects for the baby. As such, it's still important to discuss risks and benefits of the specific medications. With treatment, PPD symptoms usually improve. However, there are times where PPD can continue and develop into chronic depression. Therefore, it is important that even after symptoms subside, that treatment is continued, and that you talk to a professional before stopping any treatments. It is also important to note, similar to other mental illnesses, it will take time to see an improvement in symptoms, as medication and therapy can take several weeks to start working at minimizing symptoms. Now we'll discuss some misconceptions about PPD. There are various misconceptions about PPD which are rooted in stereotypes and stigmas. It is important that we deconstruct these misconceptions in order to better understand the condition and observe our own biases, so we do not perpetuate this harm. The first misconception we'll look at is postpartum depression only occurs within the first few months of childbirth. While onset time can be different depending on the individual, it can develop any time in the baby's first year. Late onset postpartum depression can also occur after 1 year since the baby's birth. The next misconception is postpartum depression may result in harming the baby. This is inaccurate and based on harmful misconceptions and perpetuates harmful stigmas that impact those living with the condition. PPD and thoughts of harm do not coexist. On the rare occasion that these thoughts may occur, the condition is called postpartum psychosis, which is a serious mental illness that results in a loss of sense of reality. PPD results in crying all the time. Symptoms range in those living with PPD. Some individuals do cry, however many people feel numb and may hold in their emotions. This misconception can lead to a misunderstanding of the condition and an underdiagnosis. And finally, PPD means that they do not love their baby. This misconception is inaccurate. The prevalence of mental illness is due to chemical imbalances and does not equate with love. PPD can impact bonding with a baby due to mood fluctuations, but it does not actually impact the love that a parent feels for their child. Coping with PPD. There are various ways someone can cope with postpartum depression, including working on the bond you have with your baby. As postpartum depression results in mood fluctuations that can impact this bond, it can be important to work on this relationship. While PPD can make this difficult, it can improve symptoms, especially through the release of a chemical called oxytocin, which results in improved mood. Another method is self-care. This can be critical in coping with postpartum depression. Some ways to do this include sleeping or taking a nap, which can be important for parents, ensuring you eat enough, going outside and enjoying the sunlight, or treating yourself to something you enjoy. You can also start to add exercise into your routine. Exercise can be beneficial in improving mood and can be added as a goal to accomplish. Exercise can have positive impacts on some of the symptoms as well. You can also create a support network. Having supports to talk to can help with stress and discussing how you're feeling, as PPD can result in feelings of loneliness. Ensuring you have a support system or someone to talk to can help combat this feeling. You can even create new relationships, such as going to support groups or a parenting group. And finally, get professional help. When symptoms start impacting your life, it can be important to talk to a professional. Not all methods of treatment will work for everyone, but it can be important in managing and ensuring symptoms do not get worse. Supporting someone living with PPD. There are various ways to support someone living with postpartum depression. Not all ways of supporting will work for every individual, so it can be beneficial to always ask what is needed in terms of support. However, there are a few beneficial methods, such as asking how they're doing. It can be important to talk to the individual about them, and not just about the baby. By repeatedly visiting to check in about how they're doing, while ensuring a safe space for open conversation, it can help someone feel validated and listened to. It is important to remind them that they can love their child but still feel down. You can also avoid problem solving. Oftentimes people will try to support someone by going against what they say they are feeling or thinking. For instance, saying you're not a bad mother, you're a great mother. While this is well-intentioned, it can make the individual feel invalidated or guilty. It can be more supportive to say statements such as, "That seems really difficult." If you have any lived experiences, you can also share them when engaging in conversations to let the individual know that they are not alone in their feelings. You could also offer to go to doctor's appointments. Oftentimes at these appointments, the focus is on the baby and not on the individual, so many needs of the parents are missed. If they would want you there, it can be beneficial and you can be an advocate and support. You can also ask for specifics on what you can do to help. While it may be well-intentioned, saying, "Let me know what you need," might not be as beneficial, as now this individual has to think of what they need assistance with. Asking, "Can I bring you dinner?" or "Can I do the dishes while you nap?" can be more beneficial, as they do not have to assess what they need, and it can promote self-care. Focus on their successes. Finding small successes and celebrating them, such as putting the baby down for a nap or eating breakfast, can help. While small, these can be major victories, and it can be reassuring to celebrate them. And finally, while it is important to take care of others, it is equally important to look after yourself. If you begin to feel overwhelmed as well, it can be beneficial to talk to a professional. Supporting a client. There are a few ways practitioners can support clients living with postpartum depression, including helping them build a support system. It may be difficult for them to figure out where they have supports and who they can talk to, but it can be important to discuss the people that they have in their lives that they can lean on so that they can build a strong support system. If they do not feel they have anyone to go to for support, you can encourage clients to try support groups or a parenting group. You can also remind them to be easy on themselves. Oftentimes, mood fluctuations can lead to individuals being difficult on themselves, resulting in negative thinking patterns. It can be beneficial to remind them that they do not need to accomplish everything, and they can focus on a few things each day so they do not get overwhelmed or burnt out. And finally, remind clients to take care of themselves. Oftentimes, people with PPD will forget to look after their own well-being. Encourage them to set up routines filled with exercise, eating, and time for themselves alone for self-care. Going outside for fresh air can also be beneficial. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude this video with some important points to remember. Experiencing PPD is not a flaw or weakness, or even a sign that something is wrong with you. It is simply a complication that can occur after giving birth. PPD is depression associated with having a baby and can interfere greatly with everyday life. There are a few risk factors that can be separated into 5 categories, including psychological factors, obstetric factors, biological and hormonal factors, social factors, as well as lifestyle factors. There are various warning signs that can occur after giving birth, and they can range from mild to severe. To continue with some important points to remember, there are a couple of treatment options available, including medication, psychotherapy, or a combination of both. Misconceptions about PPD are important to deconstruct as they perpetuate stereotypes and stigmas, harming those living with the mental illness. There are a few ways someone can cope with PPD, as discussed in the video, but it can be critical to find professional support. You can support someone living with PPD, however, it is important that you also take care of yourself. And finally, practitioners can support their clients in different ways, as we discussed in this presentation. That concludes this presentation on postpartum depression. Thank you for watching.